Good afternoon and welcome to the Supporting Client Health and Wellness class presented by the Far Northern Regional Center's clinical team. My name is Nellie Camarena and I am a nurse. I work out of the FNRC office in Chico. With us today is Jen Badger, our nurse in the Reading office. If you want to say hello.
Hello.
Thank you. And I'm not sure if Katie is on. She's our other nurse in the Reading office. But thank you again for taking the time to join us today. Today, Jen and I will be reviewing urinary tract infections. And you'll see us both pop in and out going over this together because as we will be presenting together today. So let's get started. In today's agenda, we're going to be going over the urinary tract system. You see out there the list of different topics that kind of surrounds that, as well as the urinary tract infections. Move on to the next slide. Okay. So I thought I'd first start off with the very basics of the urinary tract system, as we'll be referring back to this throughout the presentation. So the urinary system's function is to filter blood and create urine as a waste byproduct. And as you can see here, the organs of the system include, you'll see the kidneys, the renal pelvis, the ureters, bladder, and urethra. So as the body takes in nutrients from food and converts it to energy, right? That's normally what happens. And after the body has taken the food components that it needs, those waste products are left behind in the bowel and in the blood. So then the kidney comes in and the urinary system to help the body eliminate any waste. And that liquid waste is called urea. And to keep chemicals such as potassium and sodium and water in balance. So there's a lot of things that the urinary tract is responsible for. And the urine that is the urea that is carried in the bloodstream to the kidneys, and then it is removed along with the water and other waste in the form of what we know as urine. So in a nutshell, the urinary tract makes and stores urine. So the urinary tract system, as mentioned, it consists of the kidneys, which are the small bean-shaped organs on the back of the body, and those are located kind of around above the hips. Most people have two. They help filter water and waste products from the blood, which, as mentioned earlier, then turns into urine. The ureters are those thin tubes that carry urine from the kidneys down to the bladder. You can see it labeled there on this slide. And then the bladder at the bottom is a balloon-like organ that then stores pee or urine before it leaves the body. And then the urethra is a tube that carries urine from the bladder outside of the body. So all of these parts of the urinary tract, the kidneys, the ureters, bladder, and urethra, everything has to work together, right, to be able to urinate and filter out those waste products normally. The other thing too is, let me go back. Okay, is that the urinary tract also includes two sets of muscles that work together as a sphincter, closing off the urethra to keep urine in the bladder between trips to the bathroom. And then the internal sphincter muscles of the bladder, neck, and their urethra stay closed typically until the brain sends signals to urinate. The external sphincter muscles, you see it labeled, but you can't really see it on this picture, surround the internal sphincter and provide an extra pressure to keep the urethra closed. This is why, typically for someone who doesn't have any issues with incontinence or anything or any other neurological issues, you can carry on with your day and the urine can remain in the bladder, and then with all the signals between that and the brain can tell you, okay, now it's time for me to use the restroom. If not, we didn't have all of that in place, we wouldn't be able to keep it together, or, keeping the urine from leaking out. So, to be able to urinate, the brain signals the sphincters to relax. Then it signals the muscular bladder wall to tighten, and that's what causes a squeezing of the urine through the urethra and out of the bladder. And obviously there's a lot of conditions and even medications that can affect how the system works. But for the purpose of today's class, we're really just focusing on the very basics and understanding, the urinary tract system, and later on, discussing why urinary tract infections happen. So I'm going to switch to the next slide. So I'm going to pull up this poll. Hopefully you all can see it. So true or false, normal urine is free from bacteria. You should be able to see the poll come up. If you don't, feel free to use the chat box. I'll give it a few more seconds. Okay, I'm going to end the poll and we're going to go to the next slide. So here are the results. And actually, I know it's kind of a tricky question, but the answer is true. And let me go to show current. Okay. So urine contains fluid, salts, and waste products, but typically it should be free of bacteria. Not that there can't be some trace, but typically there should be free of any bacteria, viruses, and other disease-causing organisms. So then how do UTIs happen? So, well, as mentioned in the previous slide, the kidneys create the urine when they remove waste products, right? And that excess water from the blood. Urine usually moves through the urinary system without any contamination. However, bacteria can get into your urinary system, which can then cause the UTIs that we're going to talk about today. So UTIs happen when bacteria, and it's usually from like the skin or like the rectum area, enter the urethra and infect the urinary tract. The infections can affect several parts of the system, but the most common is a bladder infection, which we'll talk about later on during this presentation. The most common ways for bacteria to enter the urinary tract is by feces from the rectum finding its way into the urethra, which can typically occur when someone improperly wipes their perianal area. Again, we'll go over that later on in this presentation. And then UTIs are most commonly caused by E. coli, which is a type of bacteria commonly found in the GI tract, but some other bacteria can be the cause. And then women are kind of more prone to getting UTIs because of their urethra. The tube that you saw on the previous slide from the bladder to where the urine comes out of the body is shorter than a man's. It makes it easier for bacteria to actually travel up into the bladder. UTIs could also occur when small amounts of urine is left sitting in the bladder, so like it's stagnant. And this can happen when the bladder is not emptied completely during urination. So it creates an environment for bacteria to grow. And then individuals with a urinary catheter, which we'll talk about later on as well, so another risk factor. And as I mentioned here, kind of just an overview of how UTIs are caused and the type of bacteria most commonly found. Okay, one other question, and I'll try to make this one quick. So let's go back to true or false. If an infection of the urethra isn't treated, the bacteria can move up to the bladder, causing an infection there. I'll give it a couple of seconds before I stop and share the results. Okay. So the correct answer is true. If a bladder infection is not treated properly, bacteria may also sometimes go up to the ureters to infect, the kidneys, which is actually, a little bit more serious, which again, we'll talk about later on. Okay, and with that, I will pass it back to Jen.
Thank you, Nellie. So I'm just going to talk a little bit about different types of UTIs. Uncomplicated or simple UTI, sometimes called a lower urinary tract infection, but also sometimes called acute simple cystitis. And itis meaning infection, and cystitis is referring to infection in the bladder. So these affect pretty much anyone, right? A normally healthy individual without any structural or neurological issues. It's very, very common, and the infection is confined to the bladder and urethra. So it's just staying there where the urine is collecting in the bladder, and is typically much easier to treat. Then you have what's called complicated UTIs. And this is any urinary tract infection in individuals with risk factors that increase the likelihood and danger of the infection. To put it in simple terms, if somebody is high risk for a UTI and high risk of having complications from having a UTI, then their UTI would be considered complicated. They're just more difficult to treat, and there's more thought that needs to go into how to treat that infection to make sure that we prevent any bad complications from occurring. It also refers to any UTI in individuals that have risk factors increasing the chance of failing antibiotic therapies. So if, for instance, the bacteria that's causing the UTI is antibiotic resistant, or perhaps the individual has tried certain antibiotics and they haven't worked in the past, then that would also be considered complicated. An upper urinary tract infection is also often called pyelonephritis, which is basically referring to an infection of the kidney. It involves the ureters and kidneys. So it's moved past the bladder into the tubules or the tubes that drain from the kidneys, and then it's traveled up into the kidney. So here's a nice picture that has some of the anatomy and some kind of close-ups of places where you might see a UTI. Cystitis, again, is here, that's just in the bladder, cystitis, and urethritis, which is possible too. Sometimes a person can have, symptoms when they urinate, but it's only the urethra that's so far infected. Generally, that means that it's been caught early. In males, the infection can go down the urethra to where the prostate is and actually cause prostatitis. And then the ureters would be, making it an upper UTI, and then pyelonephritis, which means it's in the kidney. So there's also, you may have heard the term recurrent UTIs. And this is anyone who has had 3 or more UTIs in a 12-month period or 2 or more in a 6-month period. And it shouldn't be confused with relapse UTI. A relapse UTI is when someone has a UTI, they take their antibiotics, and then they finish their antibiotics and the UTI comes back. So it's the same bacteria, it's essentially the same UTI, it just didn't respond completely to antibiotics. So that's relapse. Whereas recurrent, it may be caused by a variety of different bacteria. Each UTI is kind of its own separate incident. But it's pretty common that we see this happen with our clients where they have recurrent or repeated UTIs. I'm also going to talk here a little bit about catheter-associated UTIs. So a urinary catheter is a tube that goes into the bladder, and it generally stays there. I mean, there are what's called straight catheters where someone might put a tube in, drain the bladder, and then take the tube out. But a Foley catheter, or this type of catheter in the diagram here, is one that's meant to stay in the bladder for a time period. And it just drains whatever's in the bladder into a bag, and then the bag is emptied and the urine disposed of. But the catheter itself can actually stay in for a very extended time, and some people have to use a catheter for the rest of their lives, depending on their situation. Unfortunately, though, the longer a catheter is utilized, the higher the risk of having a UTI. I actually read an article that was saying that basically every catheter bag ends up kind of with a coating of bacteria, fungus, and stuff on it, just from having the urine sitting in the bag most of the time. So it's actually a source of infection at some point. When someone gets an infection related to a catheter, they generally have to have the catheter removed, thrown away, and get a new one that's sterile while they're getting treated for their UTIs. So, and many types of bacteria and fungus can actually cause catheter-related UTIs. When I say fungus, I'm mainly referring to candida or yeast, which we see fairly often in folks who are hospitalized or have a catheter for a long period of time and are being treated with antibiotics. They tend to get yeast type infections of their catheter and then UTI from that. It's the big point, though, with catheters is that just really strict infection control measures need to be used anytime someone has a catheter, and with any care that's being provided to that individual for pericare, bathing, incontinence, etc. So there are a lot of risk factors for UTI, and the risk factors listed on this page are not specific to the developmentally disabled population that we serve. UTIs are more common in females, as Nellie had said, because the urethra is shorter and it's also closer to the rectum, so bacteria can easily travel into the urinary tract. Anyone who's had a history of a prior UTI is automatically at a 20 to 30% higher risk of getting another one. So, and I'm not sure what the relationship to that is. I don't know that it means they never got rid of it, but I think just if someone has a urinary tract infection, chances are some of the conditions that led to that have probably not changed, and maybe that's why they're higher risk of getting another one. So if you work with clients who have UTIs or especially have had recurrent UTIs, there's a good chance they'll probably have another one at some point. Sexual activity, simply because there's a lot of movement going on around the area, and bacteria can be inadvertently moved toward the urethra opening. Changes to the bacteria that normally live in the vagina can lead to a UTI. For example, women who are experiencing menopause or who use spermicides, those things can cause bacterial changes and lead to urinary tract infection. Pregnancy increases the risk due to hormone changes. There's also more sugar in the urine, which bacteria love sugar. There's more protein and hormones in the urine. And as pregnancy progresses, there's some difficulty in emptying the bladder completely because there's a big baby sitting on it. Older adults may not have the classic symptoms of UTIs, but they also have weaker muscles in the bladder and the pelvis, and they get dehydrated easily. So that's one of the reasons why they're high risk. And young children, they commonly get UTIs as well because they have shorter urethras, they're in diapers or potty training, they're learning how to wipe appropriately, and sometimes they hold their pee, and taking bubble baths is actually a contributor as well. An individual with structural problems that affect the flow of urine in the correct direction and out of the urethra are going to be at a higher risk. And this can be things like an enlarged prostate that narrows the urethra in men, causing incomplete emptying of the bladder, or it can be reflex nephropathy, where the one-way valve at the bottom of the ureter doesn't work properly and urine can flow back up toward the kidneys. We have many clients who have structural issues related to their developmental disability as well. And so those things hopefully people are aware of, and so they can just keep in mind that they're at a higher risk for urinary tract infection. Poor hygiene is a risk factor, either not wiping front to back or just not keeping a clean perineal area, or touching the genitals when, with dirty hands, that, you're introducing bacteria that way as well. Again, using catheter, having type 2 diabetes, especially if there's some nerve damage that causes bladder neuropathy, those individuals are actually 5 times higher risk of having a UTI because their bladder isn't emptying completely, but also they have a lot of sugar in their urine if their blood sugars are not being well controlled. And sugar promotes bacteria growth. And dehydration increases risk because you're just not flushing out of the bladder as well as you could be. It's important to stay well hydrated and avoid caffeine as well, because caffeine is a dehydrating chemical. So there are some risk factors listed here that are specific to the IDD population. Individuals with a developmental disability tend to be at a higher risk for UTIs when compared to other cohorts. Individuals that have any type of incontinence or urinary retention, if they have frequent hospitalizations, or even just being in congregate living, are at higher risk of UTI. People with developmental and intellectual disabilities often have trouble understanding that thirst is a sign that their body is bordering on dehydration. And so they easily can be dehydrated, which can put them at higher risk. And also keep in mind that individuals who are developmentally disabled or intellectually disabled often have difficulties expressing their wants and needs effectively, which includes difficulty in sharing when they're experiencing physical distress. So they may not be able to actually tell you about earlier signs of having a UTI. You may not even be able to observe behaviors related to discomfort that they're having until it's pretty severe. And to that note too, sometimes people can have really challenging behaviors, like, you know, a sudden change in aggression or self-injury. And so those symptoms, you know, while they seem like they're not related to something as simple as a UTI, they can often be that the one way that they're communicating that they're uncomfortable. All right, I'm going to hand it back to you, Nellie.
Thank you, Jen. Okay, so what are some signs and symptoms of UTI? So I'm going to launch our last poll. Hopefully you can see this. So it says burning with urination, back or side pain, painful urination, or all of the above. Okay. And I'm going to end it. I think there's a lot of you that answered. Hopefully we can see the results for this one. So correct answer is all of the above. These can all be some signs and symptoms of a urinary tract infection. And, you know, UTIs don't always cause, you know, symptoms, but when they do, it could be a variety. You know, it might be a strong urge to urinate that doesn't go away, a burning feeling when urinating, having to urinate fast, you know, often, passing small amounts of urine. Urine that looks cloudy or is like very strong smelling can also be another sign. If there's any red, bright pink, or like a cola colored tint to the urine, these can all be signs of blood in the urine. So that's also a red flag. You know, like if it's, sometimes it depends on where the infection is, right? If it's like the bladder area, some might feel some pelvic pain, especially like in the center of the pelvis and around the area of the pubic bone. Each type of UTI, again, it, you know, might result in more specific symptoms depending on, you know, what part of the urinary tract is affected. I know Jen kind of mentioned some of the signs and symptoms that we might see with an individual and some risk factors in the population that we serve, but other things, you know, to keep in mind is they might have a higher than normal temperature, might be one of the first signs that someone's developing a UTI, especially in someone who is nonverbal and can't tell you that something's hurting. Any grabbing, pulling, or holding kind of like genital area, you know, more than usual, or if it's something that's new that they've never done before. Increased irritability, agitation, if they're refusing to eat or drink, or they just kind of have like a poor appetite. Any new onset of bowel or urinary incontinence is also kind of like a red flag to keep in mind. Or having to numerous repeated trips to the bathroom. If they're really tired, you know, that could be, you know, normally they're cheerful and perky, and all of a sudden you see a little bit of difference in behaviors that can be kind of a red flag. And then falls. that can, and that can happen in various ways. It could be that maybe they're experiencing incontinence, and that an incontinence episode may lead to slips on wet floor surfaces, or they're having to go to the bathroom so often that maybe they're hurrying to the toilet, especially like in an unfamiliar or dark areas. And then some individuals might experience some like delirium or drowsiness, or even like low blood pressure can also increase the chances of pause. So this is why, and anytime you see any, especially if an individual is like nonverbal, if you see any changes in behaviors or an elevated level of challenging behaviors that's not typical, it's always important that any potential medical conditions like a UTI is, examined and ruled out. Next slide. If someone is suspected of having a UTI, the provider may ask for, a urine sample, and the urine will be looked at in a lab to check for, any white or red blood cells or bacteria. That's usually kind of the first step. Many times, these lab analyses of the urine will be followed by a urine culture. This test tells the provider what type of bacteria is causing the infection, which will also help the provider know which medication will be most effective. Though, keep in mind that a culture will take several days to complete. If a UTI does not respond to medications, or if there's a frequent recurrence of infection, the healthcare provider may order other tests to check for illness in the urinary tract system. So this might include like an ultrasound, any pelvic exams, x-rays of the urinary tract, an MRI, CT scans, or a cystoscopy, which is a scope of the urinary tract. Jen kind of mentioned earlier that UTIs may sometimes be caused by a structural problem in the urinary tract. The ultrasound, or a CT scan or MRI can help look for these issues. So again, if you're working with an individual that has these repeated UTIs, these are some things that you should kind of expect to be ordered, or, if we're advocating on behalf of someone asking, when is a good time to do further testing to kind of get, boil down to what's really going on with that individual. If a UTI is confirmed, then antibiotic treatment should be started immediately. And I listed on this page some medications that are commonly used for UTIs, like Bactrim, cephalexon. So some of these are just kind of more common ones. In addition to that, the provider may also order or recommend the individual take Advil to help with some of the pain symptoms. And then you see this other medication listed on here, phenazopyridine, may also be prescribed to treat the symptoms of the pain, burning, and itching that some individuals might experience. Keep in mind with this particular medication, it helps with the pain and burning, but it also may cause the urine to, become, or it causes the urine to become like a bright orange to golden color, and it can stain bed sheets and clothing. So just keep that in mind, nothing to be alarmed, but if you are working with an individual that is on that medication, that is one of the side effects. In addition, I know we'll talk about this a little bit more later on, but individuals diagnosed with serious kidney infections may need to be hospitalized for IV antibiotic treatment. So those are a little bit more serious. If the UTI persists once the initial treatment has started, the provider may need to switch to something else. And then again, maybe they're waiting for results from the culture, And at that point, might be another indicator that another choice would be more effective for that individual. And the antibiotic treatment, depending on which one is prescribed, can range from 3 to 10 days, depending on the infection and the prescription. And as always, with any of the medications that are prescribed for clients, should be taken exactly as prescribed, especially with antibiotics. We might have individuals that might feel better in a couple of days and think that they don't need to, complete their medication, but that's, we really need to make sure that they take it as prescribed. So if it's prescribed for 10 days, they should be taking it for the full 10 days, even if they feel better halfway through. We don't want them developing any type of resistance to the antibiotics. So that's kind of just in a nutshell what some of the treatment and workup that might be recommended for an individual with UTI. With that, I'm going to pass it back to Jen, who's going to talk a little bit more about complications.
Thank you, Nellie. Well, it's a long list here of different complications from having a UTI. And, these are possibilities of what can happen. And many of them are things that happen when an individual has a UTI that goes untreated for a while. But a UTI can cause someone to become incontinent. And then if it moves into the prostate area, it can cause prostatitis, which is swelling of the prostate, inflammation, infection. And then if that occurs, there's always the chance of developing an abscess in the prostate, which would be very bad, actually. I imagine super painful. But abscess, if you don't know what that is basically a collection of bacterial infection in kind of a confined space. So pyelonephritis, that would be if it moved up the ureters into the kidneys. And pyelonephritis can cause permanent kidney damage. It can damage the nephrons that are filtering your blood. It can inevitably lead to acute kidney injury or even kidney failure. And along with that kidney damage, you can develop hypertension or high blood pressure simply because the kidneys are not filtering out water well enough. And so you're retaining fluid, which can cause high blood pressure to develop. And then, of course, what we see a lot of the time is folks go to the ER and usually they're very symptomatic, very, very sick, and they have sepsis. And that means that the urinary tract infection, those bacteria have now entered into the bloodstream and caused a systemic infection. In men, having UTIs, especially recurrent, can cause narrowing of the urethra. And this is, of course, not good because it then further makes the UTI worse or more frequent UTIs because the urethra is not wide enough to allow easy emptying of the bladder. Persistent lower urinary tract symptoms, and that's, that could be the incontinence. It could also be urinary retention and discomfort with urination. Staghorn kidney stones, this one, I wish I had put a picture on here. They're very, very interesting. They can develop with a severe UTI or chronic UTIs. And those types of kidney stones are not the kind that will, pass through the ureter. And I'm sure you're familiar with, passing a kidney stone. It's very painful, right? Because they're little sharp stones. But staghorn kidney stones actually develop and fill in, they have like these horns, if you will, that fill in the different segments of the kidney where the urine is made and getting ready to leave the kidney, but because of the shape, they can't be passed like a regular kidney stone. Also, in cases of pyelonephritis, you can have a focal renal nephronia, which is basically a collection of bacterial infection in a specific area of the kidney, nephritis, if you will. And then that's sort of the halfway point between having simple pyelonephritis to getting a renal abscess, which again is a collection of purulent liquid in a confined sort of space. And then emphysematous pyelonephritis and cystitis is when the bacterial infection actually causes the production of gas in the kidneys and the surrounding tissues, and it can be very painful and actually has a pretty high risk of death with that once it gets to that point. So let's talk a little bit about prevention. There are a lot of prevention do's, things that will help hopefully keep UTIs at bay, right? The first one on the list is proper bathroom hygiene and incontinence care. We're going to talk more about those in just a minute. But, you know, having the client urinate more frequently, you know, every hour or so, maybe reminding them to go use the bathroom, and also to not be in a hurry. Make sure that they empty their bladder completely so they're not holding any urine in the bladder that can allow bacteria to grow. If individual is sexually active, it's important to wash the genital and anal areas before and after sex, just to try and reduce that bacteria that's been moved around to the urethral area. Urinating before and after sex is also helpful. That way, if any bacteria got into the urethra during the intimate moments of the day, then urinating can hopefully wash it out and prevent a UTI from occurring. Taking showers instead of baths, wearing cotton underwear that are breathable. They don't hold a lot of moisture and heat inside because bacteria love anything that's moist and hot. So wearing underwear that's breathable is also really important. Staying hydrated, make sure they're drinking lots and lots of water. 64 ounces a day is kind of the average recommendation. So that's 8-ounce glasses. Control that diabetes, keep those blood sugars in a normal range so that you don't have a lot of glucose and sugar in your urine. And then, you know, some people try taking like vitamin C or probiotics or cranberry. The studies are a little bit inconclusive with cranberry, but I think the main goal with that is raising or lowering the pH to make the environment more acidic and less of a happy spot for bacteria to grow. And then probiotics, the reason why some people take those is because it's adding good bacteria to your GI tract. So hopefully if any bacteria is migrating towards your bladder, it's not the bad kind. So that's kind of the thought process on that. You should ask the doctor, of course, about taking any new supplements. But for postmenopausal women who are having trouble with UTIs, also hormone replacement therapy may be helpful, and that's something to talk with their doctor about as well. And then just take care of your general health. You know, keep your immune system strong, keep healthy, eat well, sleep well. All those things are going to help you fight off any potential infection. And then there's the prevention don'ts, a shorter list, but still avoiding excessive alcohol consumption. Alcohol is an irritant to the bladder, and it can cause inflammation, which can contribute to the development of a UTI. Also, alcohol has a lot of sugar in it. Avoid consuming a lot of sugar for the same reason. If your urine is higher in sugar, and even if your GI tract is higher in sugar, I think you'd have a lot more bacterial growth. Scented or irritating feminine products should be avoided. And then for breathability, avoid really tight fitting pants. And then also for birth control, diaphragms and spermicides have both been linked to UTIs. So might be a good idea to try a different type of birth control if that's what the individual's using. So let's go ahead and dive into bathroom hygiene. So just some health challenges that affect people with developmental disabilities can keep them from maintaining their hygiene. And this could be, mental capabilities, behavior problems, mobility issues, and even visual or hearing impairments. And mental capabilities can have an impact on how well someone can follow directions. So if you're giving them guidance and you're prompting, and they might not be able to follow those instructions, especially if they're using the restroom alone and taking care of their own peri care and hand washing and all that, they might not be doing such a great job just simply because they don't have the capacity to recall instructions or follow directions very well. And behavior problems too can complicate personal hygiene care if the person's uncooperative. But a lot of our clients, have pretty significant mobility problems, and those individuals really, need a lot of help from staff. So what we can do is we can teach bathroom hygiene. We can model it, and it doesn't mean that you need to go use the restroom with your clients. It just means like showing them maybe visually what it would look like when they're doing a good job of bathroom hygiene. Prompting individuals if they're using the restroom alone and they like it that way, then maybe just prompting them with some a little short checklist of don't forget to wash your hands and don't forget to clean up well, that kind of thing. I know you guys do that all the time with stuff to help our clients, but also some clients need a lot of assistance in the bathroom too. They may not be able to reach behind very well, and so they may be tempted to clean up from the front. And of course, you definitely don't want to be wiping from the back to the front, because that's just going to contaminate your urethral area. Washing hands before toileting is a good idea, especially if they're dirty, because otherwise you could be just introducing germs from your hands too. Wiping front to back, as I said, and a client may need help with this. So if you're working with someone who you don't believe can physically wipe from front to back, they can't reach around or the right way to do it, then you might need to help them out with that. And that's a conversation that you can have with the client, and just assure them that you're there to help and offer assistance if you can. Remind them that they need to keep wiping until it's clean, and then finishing with like a flushable wipe is a good idea, just to make sure the whole area is good to go. If cleanup's really difficult, and sometimes it's just more difficult, right? And so if it's not an easy toileting experience that could be managed with toilet paper and a wet wipe, then it's a good idea to go ahead and clean up with some soap and water, or just pop in the shower and clean up that way really quickly, so that you can make sure that there's no fecal material that is left down there. Because anything that is, it's going to travel to that area. And then always washing hands after toileting. And we all know that, but we all sometimes need some reminders to do so. So regarding clients who are incontinent, those individuals who, if they're dependent on staff to change them, I mean, it's just important to know that they need to be changed like as soon as possible if they've had an incontinence episode. And that's whether it's only urine or if, there's feces involved. But it's just important, that we're doing that frequently, that we're frequently checking to make sure they're still dry, that we're taking the time to, make those changes, brief changes or whatever that individual requires. And, if you can, it's a good idea to teach individuals who have incontinence that they need to let you know right away if they've gone. So here, for incontinence care, I did put the steps on here. I'll go through them very quickly. But you always want to make sure that you are washing your hands thoroughly and that you're wearing gloves when you're providing incontinence care. And take a minute to check, the whole peri area for any signs of infection. So this would be any redness, swelling, discharge, rashes, sores, and make sure, if you see something like that, then, make sure that you're helping the client get in to see a doctor, or that you're, at least letting your supervisor know. Note any abnormal urine, like very dark urine, or if it's very foul smelling, or any red urine, which would possibly indicate blood in the urine, which can be a sign of a UTI as well. And then when you're providing peri-care, you want to pay attention to any signs of discomfort when you're cleaning the individual up. If it's very uncomfortable for them or appears painful, then it's probably a good idea to get them checked out. When you're providing actual care, to clean them up, you want to make sure that you are moving from front to back as well. You want to use warm water and a clean cloth or disposable wipes, and make sure you clean the whole perineal area. And get a fresh wipe for each swipe. And what that means is, once that wipe is dirty, you need to get a new one, because otherwise you are spreading bacteria, right? By using something that's already contaminated, if you will, and then, going up around the urethral area, that would just be likely to cause a UTI. And have a bunch on hand, like I'm sure that most of you do. You have those, a box sitting around, but if you don't have them right next to you, make sure you bring plenty. And again, never moving from back to front. If the client has a Foley catheter, you should start at where the urethral opening is and clean around the catheter tube, and then down the tubing away from the individuals. So you're going to use a clean cloth each time that you do this too, so that you're not grabbing bacteria off the tube farther down and then reintroducing it up where the urethra is at. So everything is moving away from the urethra. And if your gloves become soiled, you should definitely take those off and grab a fresh pair if you're not finished with providing that care for them. And when you are totally done, make sure that you're thoroughly drying everything, because as we know, any excess moisture can lead to chafing or rashes or even bed sores. So you want to make things nice and dry and nice and clean. And then, you know, putting on a fresh, clean brief or pad or clean underwear if that's the case. If there's any soilage that occurs to like the linens, please don't just like clean the linens with a wet wipe and then leave it like that. That's not going to kill the bacteria on there. And those linens need to be removed and washed and dried before putting them back on the bed. So I think that is pretty much it for our slides. Does anyone have any questions or want to share any stories about things you've gone through with clients related to UTIs? We'd love to hear about it.
Feel free to use the chat box as well.
I know we covered a lot. I hope that we were able to answer any questions that you had in mind when you came to the class today. But you know, if you think of it something that we didn't touch on that you'd like to learn more about, please let us know. It looks like we don't have any questions in the chat and nobody is unmuting. So I guess we should probably call it a day. So thank you.
Yes, thank you, everyone.